Welcome to the Thyroid Fixer podcast, where we dive deep into the world of thyroid and hormones, especially for you ladies navigating perimenopause and menopause, and really for anyone struggling with hypothyroidism. I'm your host, Dr. Amy, thyroid and hormone specialist and CEO of a global telemedicine practice where we prescribe the right thyroid treatment and bioidentical hormones to all 50 states and most of Canada, helping you become that badass human that you're meant to be. So if you're battling weight gain and hair loss, you can't lose weight no matter what you do, your energy levels are plummeting and your libido left town, then you're in the right place and you have found your tribe. Remember, I want you to embrace every inch of that badass woman that you truly are. So if you're ready to dive in and fix things, let's get started. You know, I am so passionate about giving you information that you can implement to actually change your life, change your body, fix your thyroid, fix your hormones. So that is why I am doing, for the first time ever, a Fix Your Thyroid Masterclass. Time to break free from the fatigue and the fat that we're dealing with and that we're so frustrated with. So I want you to attend live. I want you to be there live. We are going to go over so many things. The TSH trap, what doctors should test and they don't test, even integrative and functional practitioners, how they're treating or how they're scamming you, these thyroid detoxes out there, what supplements you really should be using. We're going to give you real answers, and we're going to end with a live Q&A with me. So that's why you have to be there live. We are doing this in September. So click the link below. It'll have all of the information, the dates, the times, the sign-up info. Go to fixyourthyroid.com and you'll find it there. You'll find the details. I want you there. I want you signed up. I want to see you in the meeting. And I want you asking your questions and taking notes. Let's do this together to get you to the next level. Fixyourthyroid.com. I hear your questions about what are the benefits of red light therapy with the thyroid. Well, when you go down that rabbit hole of studies, there are multiple benefits. How shining red light on your neck can absolutely help to produce more thyroid hormone and heal the thyroid, but it does so much more. But here's the thing, that red light, you don't want to just go out and buy any red light panel. There are different wavelengths that you need to look for. You want it combined with UVB because UVB light has a whole host of potential benefits of its own. So number one, UVB triggers testosterone production and libido by triggering the P53 protein. Amazing. Sunlight. We know how important sunlight is to resetting our circadian rhythm, to even helping us lose weight and with our sleep and our blood sugar balance. UVB light does that. So when you get that dose of UVB in the morning, that's going to help stimulate that testosterone, reset your circadian rhythm, up-level your vitamin D, amazing things. Here's all the other things that it can do. It helps with your microbiome health and diversity. It helps reduce cancer risk, including thyroid cancer, reduces your COVID risk. It prevents weight gain. Like we said, your testosterone, your sleep, it helps with MS. There's a study on that. I would love to put all these studies in, but I don't want to bombard you. Reduction in psoriasis and vitiligo, reduce depression, better mood, throw out the antidepressants. Let's just get some sun, UVB and red light. Oh my God. Cognitive function and memory. And of course, your skin, stimulating that collagen production to reduce wrinkles and just improve the overall quality of your skin, reduction of acne, healing of scars. Just really doesn't get any better than this. And this light that I've been using, which is by Mitochondrial, is just so compact. I set it right on my desk so I can literally use it every day. I have it on right now as I'm recording this. I shine it on my face and on my neck every single day. I hit my décolleté as well because I want to prevent sun damage. I want to reduce all those brown spots of aging and promote collagen because I don't want a wrinkly chest either. Who wants that? So if you want to check out this bad boy, this is amazing. If you're going to invest in a red light, you want Mitolux. You want to go to mitolux.com/Dr. Amy. So mitolux.com/DRAMIE. That will automatically generate you a 10% off discount off of a Mitolux device. You will love it. Like I said, one that you're going to invest in. This is it. I promise you, this is it. You know, next to thyroid and hormones, I think peptides are my next passion. And I have to tell you, going down this rabbit hole of microdosing GLP peptides, oh my gosh, it blew my mind. And really just all about GLPs, how they can help with weight loss, inflammation, all the things we're going to deep dive into this podcast. But I also didn't want to give you all this information without an actual way to obtain these beautiful, beautiful GLP peptides, especially after you listen to the episode and you're like, oh my gosh, I need these. So if you check the show notes, I've partnered up with Trim Healthy Mama because they have found a way to make these peptides easily accessible and affordable for you. So I want you to check the show notes after you listen to the episode. That way you can really educate and saturate your brain with all the information I'm going to give you. Going to blow your mind. Could this be a miracle peptide? I believe so. There's so many indications for health of what these peptides can do. No, it's not a shortcut. No, it's not a crutch for weight loss. These GLPs produce amazing things in the body and protect the body from a multitude of assaults, basically. So just dive in, listen up, enjoy, check the show notes if you want to join me on the GLP peptide train. I cannot even begin to tell you how excited I am to bring you this information. I've been diving down this rabbit hole for a while now, really researching before I brought this to you. So this is going to begin kind of a series of sorts of microdosing GLPs, glucagon-like peptides like your Ozempic, Trulicity, Monjaro, also known as semaglutide and tirzepatide. Now, when these peptides first came out, the weight loss peptides, in the beginning, we were hearing so much bad about them, people losing their muscle and getting Monjaro face and losing the fat in their face. And I've been very open about my experience with playing around with Monjaro because that's what I do. I do this for you. I experiment on myself so I can bring you the information and the experience. And what I found doing 5 milligrams of Monjaro was that I was losing muscle. Even though I really thought that I was eating enough protein and lifting heavy, which we will go into today, it still wasn't enough to overcome what that dose of medication did. Not the medication, not the peptide, what the dose did to me. And what you'll hear in the next few weeks as we release a variety of different episodes, this one is going to kick it off on microdosing. I'm going to lay the foundation. Then you are also going to hear from Dr. Gus Vickery and Dr. Tina Moore. And you'll hear Dr. Gus and I talk about the dose that I started at. And it was just basically dropping a bomb on me. Way, way, way too high. And Dr. Tina also confirms that because she is of the belief, which I totally agree with her, that unless you're type 2 diabetic, like full-blown type 2 diabetic, you should not be using these higher doses or really the starting doses of GLPs that physicians are handing out because that's where the side effects come from. In addition to the Monjaro face and the muscle loss, I also had the heartburn. And these are the big side effects that we keep hearing from people. Heartburn, nausea, just fatigue, crushing fatigue after you take the medication. And it shouldn't be, and it doesn't have to be. So as we learn more and more about these amazing, beautiful, kick-ass peptides that can make such a huge difference in pretty much everyone's life, because no kidding, if there really is a miracle pill, this is as close to a miracle pill as you're going to get for all things that you're going to hear about today. But if it's not dosed properly, then it's going to kick your ass and you're going to get all the side effects and you're going to be scared away from it. You're going to be like, why is anybody using this? So any of the comments that I've made in the past, I retract them to a point. So there was a time where I had a nurse as a patient, and she was telling me that in the ER, they were seeing people come in with gastroparesis from using these GLPs. But what we didn't know at the time were these people were using crazy high doses, either doses that their doctors started them on, or that they increased them to, or that the patients were doing themselves because they became so addicted to losing their appetite and having that food control that they increased their own dose and thus put themselves into a state of gastroparesis. It doesn't have to be that way. It does not have to be that way. It's all in the dosing. So let's get into what microdosing is and really what these GLPs can do in the body, because, oh my gosh, when you start going down this rabbit hole, it literally blows your mind. Now, this is a very polarizing topic. So I'm sure just like Dr. Tina talks about, just like Dr. Gus talks about, I'm going to get backlash from someone out there who says, oh, no, these are horrible for you. You shouldn't be using them at all. No one should be using them. To which I disagree. And I would challenge that individual to actually do research, just like I did. Go down that rabbit hole and really start diving into research, both written and anecdotal, because it starts to really blow your mind. And you start to realize, wait, if we maintain this really uneducated point of view and you become that polarized and you die on that hill that GLPs are bad, then not only are you going to die on a hill that you didn't have to die on, you're going to be a disservice with your message to a multitude of people that could have been helped, but you scared them out of that help. So that's why I am taking a stand, educating you about the benefits of microdosing. And we're going to lay it all on the table so that you can make the best decision for yourself. After you have all of this information, you can now sit with it, re-listen to it, and make the best decision for you. Okay, what is GLP? What are GLPs? Glucagon-like peptides. Our body actually produces GLP in our gut. Now, it produces it very, very quickly. So we might get a pulse of GLP secretion in our gut, and then it quickly goes away. So that's really the difference with these peptides, is that when we do the once a week injection of these peptides, which are mimicking the naturally occurring GLP in our body, secreted in our gut and actually in our brains, then what we're finding is that these peptides are built to have a longer lasting effect in the body. So semaglutide will last about a week instead of just minutes when it's pulsated on your own by your own body. And tirzepatide, about the same thing. It's lasting roughly 5 to 7 days, which is why we dose it at a once a week dosing. No matter what dose you're on, the frequency is once a week. Now, side note, the other issue we were seeing with people having massive side effects with the GLPs is that they would dose themselves twice. Because again, it was this addiction to losing their appetite and having locked down food control, that once they had it, they couldn't not have it anymore. And they wanted to maintain that loss of appetite. Whereas realistically, when you are microdosing, you will not get the appetite destruction. You will not lose your appetite completely. You might notice that the edge is taking off, but it is nothing like taking the full dose of a GLP where you can literally not eat. You take a bite of steak, I want you to picture the most beautiful meal in front of you ever, your favorite meal, and you can take 2-3 bites of it and be done. That might sound appealing, but that's not cool. You want to be able to enjoy your food, and you have to get the protein in that you need, or you will lose the muscle. Again, we'll put all this together today. But with a microdosing, you don't completely destroy and lose your appetite. Now, it's important to go over what is GLP. So I said earlier, glucagon-like peptide 1. So it's actually a hormone. So we know that hormones are signaling molecules. They signal to the body to do something. So this is an incretin hormone. It's released by enteroendocrine cells in the small and the large intestine in response to food. So that GLP that is naturally released by our gut and our brain have certain effects on the body because signaling hormones. So number one, it actually slows your gut motility. So it slows the movement of food through the stomach and the intestines. Now, when we delay gastric emptying and we reduce blood sugar after eating, that's where we feel more full. Now, the problem with the higher doses of the GLPs is that it severely stops. It significantly slows gastric motility to the point where that meal that you ate at, let's say, 5 p.m., and I am speaking from experience here, can regurgitate and come back up as you lay down at 10 p.m. to go to bed. It literally stays in the gut undigested that long. And that's where that acid reflux, nausea, stomach upset, and sometimes vomiting comes in. And that's where you'll hear people talk about those side effects because they're on too high of a dose and they've paralyzed their gut. and it's just not moving through. That GLP action of slowing gastric motility, again, remember when we talked about it being naturally released by your gut, that should have a very fast action on the body. It should not last 5 hours, 3 days, a week. That's not right. We want you to have that feeling of fullness so that you don't overeat and we calm down that food noise, but we don't want to stop your gut motility completely. Again, what is it? What's that saying? The benefits and the poison are all in the dose. It really comes down to the dosing. Now, GLP also acts on the appetite centers in the brain to increase feelings of fullness, both during and between meals. Now, this is also that same mechanism that I talk about with metabolism fixer and suppressa. Suppressa works on the brain to reduce appetite. It works on the appetite centers in the brain. So as we work on the brain and the appetite centers, it basically tells the brain all is well here. You're full. There's plenty of food available. Everything is good. You have the amount of fuel that you need to fuel this body throughout the day, to do all the activities, to do all the brain function, do all the exercise that this person wants to do. We're good. Now, the problem is in some people with a true GLP deficiency, and we'll talk about that in a minute, that appetite center in the brain is never turned on into the full mode. It's always in the hunger mode. So feelings of insatiable hunger could be connected to leptin. Remember, leptin is our satiety hormone. We can be leptin resistant the same way we can be insulin resistant. Yes, it could be a leptin resistance that it's creating those intense feelings of constant hunger and cravings, but it can also be a GLP deficiency. So we always want to look at the action on the brain so that our brain can tell our body and really our gut and our hunger signals all is well. Everything is fine. Now, GLP also acts as a neurotransmitter. And what we're going to find when we're looking at the microdosing benefits is that GLPs can improve mood. They can improve anxiety and depression. They can protect our brains against Alzheimer's. There's a direct effect on the brain, and there's also the indirect effect because of lowering insulin and balancing out glucose. Really, I mean, that's going to pass through all disease states because our biggest issue in this country and the number one cause of disease is obesity and excess body fat. So if we can lower insulin, lower the amount of fat on our bodies right there, we're reducing our risk of Alzheimer's. But now you add on a GLP. Oh, and let's say you actually add in hormones, BHRT, to protect your brain. Now you have triple protection of your brain against the diseases of aging. Many of you know, I've been very open about it, that my mother and my grandfather both passed from Alzheimer's, and I had the APOE4 gene. I have one copy of it. So genetically, of course, I am predisposed to Alzheimer's, and it is the most horrendous disease ever. If you've never seen it or experienced it, you can't understand the severity of it, but any of you out there listening who has experienced it in one way or another, you know what I'm talking about. It's pretty much pure hell. Wouldn't wish it on anybody. So if we have tools to protect us, oh my God, why wouldn't we be implementing those tools? So GLP-1, since it is produced in the brain, it can act as a neurotransmitter, targeting receptors throughout the central nervous system. So what we're finding is this whole neuroprotective property of the GLPs, and we're seeing alleviation of brain fog, better cognition and memory. So that's the immediate effect. And then the long-term effect is that overall protection. Okay, let's talk now about the biggest cause of mortality, like I just said, obesity. And really, here's an argument as well for all the naysayers out there of these GLPs. Let's just hypothetically say you used a higher dose. Is a little bit of facial fat loss, acid reflux, a little bit of nausea, is that worth it to reduce your body fat, get out of that obese state, get out of that high insulin resistant, high glucose state, and lower all-cause mortality, literally lowering your risk of cardiovascular disease, cancer, Alzheimer's, all-cause mortality? Not to mention protecting yourself from going blind, losing a foot, a toe, a hand, extremities. I mean, come on. I'll take that all day long. But the good news is that you don't have to choose between those side effects if you do your dosing correctly, if you do the microdosing method. Now, GLP-1, what it does is it encourages the release of insulin from the pancreas. So every time we eat, our pancreas secretes insulin. Now, if we look at type 1 diabetics, which by the way, this is also good for, type 1 diabetics don't produce enough insulin. So they have to take insulin to replace the hormone that is no longer being properly made by their pancreas. GLP-1 actually encourages the release of insulin from the pancreas. So type 1 diabetics who use this might find they need less insulin, which is great because insulin is the Jekyll and Hyde hormone. We need it for life, but we don't want too much of it or it will be the fat storage hormone. That's why I call it Jekyll and Hyde. Needed for life. It is not a hormone that you want to suppress or avoid. This is why type 1 diabetics have to take insulin. But in excess, it is the fat storage hormone. It will absolutely store fat on your body. So what we want is that balance. We don't want insulin in excess. Now, you might be sitting there going, well, then why would I take a GLP-1 and encourage the release of insulin from the pancreas? Well, because when your blood sugar is high, when you have that high A1C or you're getting high readings on your CGM, we ultimately want to lower that elevated blood glucose. Because when you're walking around with elevated blood glucose levels, again, you are in an inflamed state. You are putting your body in just a state ready to develop cancer cells because we know cancer cells feed on sugar. We know that Alzheimer's is considered type 3 diabetes. Remember, I just talked about the indirect action of GLPs. By lowering that insulin, by balancing the glucose, getting you out of that highly inflamed state, insulin is actually able to shuttle glucose into the cell to do its job. So when insulin works properly, you're not walking around in a high insulin state. You're not walking around in that inflamed state. Now, speaking of brain inflammation, GLPs microdosed actually calm down neuroinflammation. Now you might be like, I don't know if my brain is inflamed. Well, are you in middle age? Are you going into a hormonal imbalance state, perimenopause, menopause? Do you have brain fog? Do you have memory cognition issues? Yeah, a lot of those are fixed with hormones. A lot of those are fixed with thyroid, but this is another tool in our toolbox to calm down that neuroinflammation and help with those symptoms of menopause and symptoms of thyroid dysfunction. Now, it's important to note that we don't use GLPs alone, meaning you can't be a menopausal woman and throw in a GLP and think that it's going to solve all your issues. No, you're still in need of hormones. You still have to replace those hormones that are no longer being properly made by your body because you are not aging like Benjamin Button. So your hormones are declining and they're eventually going to shit the bed and you have to replace them. Same thing with thyroid hormone. If your thyroid is low and slow when you're on T4 only and no one's optimizing you, then a GLP isn't going to help. And in fact, many of my patients who have tried a full dose of GLP and did not see any weight loss, well, it came back to the fact that their thyroid was in the toilet and they had no hormones. So everything works together. This is not a monotherapy. This is not a standalone therapy. It has to be used in conjunction with eating properly, addressing low hormones, addressing low thyroid function. But when it is used in conjunction with that, then we can see the benefits. The benefits start stacking upon themselves. So these are the non-negotiables. You have to be doing hormone replacement therapy, really, if you're over the age of 45. And you have to be addressing your thyroid function. There's a couple other non-negotiables that we will go over as well, whether you are microdosing or macrodosing, that we have to agree upon, that you have to agree upon before you start doing any kind of GLP. I'm checking in with you. How's your energy these days? How's your skin? How's your muscle strength? These are things that are very, very important to me. And I know just from research that after the age of 30, our mitochondria starts breaking down. And these are the powerhouses of the cell that provide us with muscle strength and better skin and abundant energy through the day. So I've added in something that I wanted to share with you, Timeline Nutrition's MitoPure. So when we look into research into healthy aging, it really focuses on that pivotal role that our mitochondria plays in our body. And without our mitochondria working at top notch, then health is just declining. And that's not what we want. Daily wear and tear on a mitochondria is inescapable, but we can do something about it now. Timeline Nutrition's MitoPure is the first supplement that has been clinically shown to replace and rebuild damaged mitochondria. And this results in a boost in cellular energy. And actually, research has shown that individuals experience an increase in muscle strength and endurance without even altering their diet and exercise routine. So, I mean, I can personally attest to feeling the difference. I am now going to ask you to feel the difference. So I invite you to go to timelinenutrition.com. They're giving my community 10% off of MitoPure if you use the code Dr. Amy. So you are going to go to timelinenutrition.com/Dr. Amy and use the code Dr. Amy, DRAMIE. So timelinenutrition.com/DRAMIE and use the code Dr. Amy at checkout. Okay, what are those non-negotiables? You have to lift heavy shit. If you're not, you're going to lose muscle. Even on a microdose, you're going to lose muscle because that's going to build up over time. And really, the muscle loss, the lean muscle loss that we saw happen and that I experienced is really from not getting in enough protein. So I was obviously activating my muscles and lifting heavy. I always do. But hindsight being 2020, even though I thought I was getting in the protein that I needed, I most likely wasn't. And hence my mother's arm showed up as I lost muscle. Now I've since reversed that, but that takes a while. You don't want to be in a muscle loss sarcopenic state as you age, because that is absolutely going to, number one, decrease your metabolism. So here you are taking a GLP to lose weight and you've lost body fat and muscle, and now you have a lower metabolism than when you started. Now you're at a greater risk of bone breaking. So, why do old people die in the hospital after they break their hip? Yeah, I mean, you fall and break a bone after the age of, I don't know, 55 or 60, your all-cause mortality rate significantly increases. Your chance of getting out of the hospital is about 50%. So we don't want that. How do we protect our bones? Have muscle. Protect your muscle. Don't lose muscle. Lift heavy and eat adequate amounts of protein. What do I mean by adequate? 1 gram per pound of lean body mass. You say, well, what's my lean body mass? I don't know what my lean body mass is because I'm trying to lose body fat. Take the weight that you want to be and be realistic. Listen, if you're 5'9", you're not going to be 110 pounds. I'm sorry. You should never be. Pick a weight that you know is your fighting weight, is your happy weight, and that's the amount of grams of protein that I want you to get in every day to protect your muscle. Okay, moving on. Other benefits of microdosing these beautiful GLPs. We are actually seeing some data on cardiovascular disease, on kidney disease. We already talked about depression, brain fog. How about pain? All autoimmune conditions, decrease of inflammation. So some studies, both, again, written and anecdotal, are showing a decrease of pain from muscle injuries, past injuries, trauma, frozen shoulder. It's almost working like BPC 157, which that's a peptide that I love post-surgery, post-injury. These GLPs are working to literally reduce inflammation in the body. We're also seeing these very, very effective on, like I said, all autoimmune conditions. So even your big heavy hitters like MS and lupus, all autoimmune conditions are a state of inflammation. Really, all disease is a state of inflammation, but all autoimmune conditions are a state of inflammation where those autoimmune soldiers are just amping up and they're attacking whatever they like to attack. So if you have Hashimoto's, they're attacking your thyroid. If you have MS, they're attacking your brain and your spinal cord. We want to reduce that inflammation and we want to reduce those antibodies, and thus we reduce those autoimmune flares. So, hey, extra bonus. Now we're going to tie this to autoimmunity. There are GLP-1 receptors in our bones, our muscles, joints, cartilage, pretty much everywhere. So just like we have thyroid receptors, we have estrogen receptors, we have GLP receptors on our cells. And because that GLP-1 has that anti-inflammatory impact on the brain, down from that, it's going to have an impact on your immune system. That anti-inflammatory impact through the body also affects the immune cells. So the GLP will bind to the immune cells and it will lower autoimmunity. So it's lowering inflammation, but it's also shifting your immune response to those soldiers that want to go out and attack, and it's calming them down and basically pushing them back into their barracks so they don't wreak havoc and start a war every single day. Now, of course, fat is very inflammatory. So as we reduce inflammation, our fat cells can release the fat to be burned as fuel. And just even being overweight, that's just you're in a state of inflammation anyways. And that's obviously going to affect every aspect of your body. Even just carrying extra weight around is going to set you up for an autoimmune attack more often and just from inflammation. So again, GLP-1 coming in, of course, it's lowering your body fat. We're doing that slowly because we're microdosing. We're not hitting you with a sledgehammer, gently tapping the hammer very gently so that we can have an effect on your body and not blindside you with a boatload of symptoms. As we get rid of the fat in your body and we reduce the inflammation, so you can see where all this is going. We're reducing your body fat, we're reducing inflammation indirectly and directly. We're improving your metabolic function, we're improving your metabolism, we're improving your brain function, we're taking down brain inflammation, improving your mood, helping you to be more satiated when you do eat so you don't overeat all the time. It's improving your heart, it's improving fatty liver. It's improving kidney function. I mean, do you see why this is a miracle? I call it a miracle pill, but it's not a pill. Do you see why this is a miracle drug, a miracle peptide? Now let's go back to that metabolism, because that's really why this is the Beverly Hills Soccer Mom drug of choice for weight loss. And people think that it's just working on your appetite and that's why you lose weight. No, that's not the case. It's working at kind of a behind the scenes level. Yes, it's balancing out your glucose and your insulin, but it's working directly on your metabolism because those metabolic effects last long after your appetite comes back. So even if you were doing the macro dosing, the big heavy hitting dosing, yes, your appetite gets destroyed. Like I said, you could have your favorite meal in front of you. You're not going to care. You're not going to eat it. But if you can eat and maintain control and eat the adequate amount of calories and protein every day, guess what? You're still going to lose weight because it's not about the loss of appetite. And here's the other problem with using those macro doses. When these Beverly Hills Soccer moms take it to lose the weight, they're not changing their eating. They're not changing their eating habits. So they are still literally getting away with eating garbage. Yeah, they can eat their pizza and drink their wine and they're still losing weight and they're thinking it's the best life ever. But then they come out the other side, they go, why do I gain the weight back? Well, duh, because you didn't even change your eating habits when you were on the thing. And that really is the tool that the GLPs are giving the people to be able to control their appetite and change their eating habits. So if you don't change your eating habits, guess what? You're going to gain it all back, and you pretty much deserve to gain it all back, honestly, because you made zero effort to change your nutrition or your lifestyle. But those who actually do the work, so if you're on a macro dose and you are really, really working hard to change what goes into your mouth, kudos to you. Those on the micro dosing who just have a little bit of food noise that they want to control, but they have a pretty good handle on their macros and what goes into their mouth and clean eating, you're not going to gain the weight back. You're going to slowly lose the weight because we don't want you like the biggest loser, dropping 10 pounds in a week. That's stupid. You're going to gain that back and you're going to lose muscle. We want you very, very slowly losing the weight as we're working on your metabolism. So think about this. Just picture this. Your body is this machine that we are optimizing every part of this machine. And we're bringing thyroid function up and we're balancing hormones. And now we add in this GLP and everything is working beautifully together. And your metabolism is slowly increasing and your brain is lighting up and your energy is getting better and you're getting stronger. And you have total food control and you're nourishing your body with all the right things. It's like a symphony. It's like this beautiful symphony. Now, I said earlier that I would circle back to this. Some people are actually deficient in GLP. Now, how do you find out? You don't. I mean, as of this date, there is no test that I can find to check for GLP. It's not in a gut test. It's not a GI map. There's not a blood test. But some people are deficient. Now, how do you know? So we can do just some Q&A. If you look back over your life, have you always had this insatiable appetite? Like nothing really satisfies you. It's just this constant hunger. You cannot control your food, and it's not from a lack of willpower. It literally is this biological force that's driving you. Is your A1C elevated? And you're like, I am literally doing all the things. How in the hell? I'm eating carnivore, I'm eating keto. How can my A1C be elevated? I'm not crazy weighing down stress. It's not my cortisol driving high glucose. That's not it. Or if you are one of those people that you are doing all the things with your thyroid's optimized. You're on bioidentical hormone replacement therapy. You're doing all the things. You're working out. You're getting good sleep. Your nutrition is on point, and the weight isn't coming off. And it doesn't make sense. And this is exactly when and where I would implement a GLP with my patients, because we have everything else corrected. We have all of the other boxes checked. So now it's the time to bring in that GLP to really take them to that next level and get the weight loss going, get the fat off. Because I don't care how healthy your thyroid hormones are, we don't want you walking around with excess body fat. And if you have a deficiency in GLP, then we need to correct that. And you might have to be on a low dose GLP for the rest of your life, but who cares? Because you're going to be on thyroid hormones the rest of your life too. And who cares? Because they are giving you quality of life and they're giving you a healthier body so that you can avoid the antidepressants and the sleeping pills and the statins and the blood pressure medication and the heart disease medication and whatever they give you to light up your brain and all the other Band-Aid medications that they give you anyways. Who cares if you're on a microdose of GLP? Who cares? Now, let's say that insatiable hunger is tied back to leptin that we mentioned earlier. Well, GLPs actually make you more leptin sensitive, make you more insulin sensitive. That's what we want. And actually, leptin, that satiety hormone, can't even work properly without enough GLP in your system. So no wonder these poor people, maybe you, have insatiable appetites because you're leptin resistant and you are GLP deficient. And that's why you can't control what you eat no matter what. And remember, GLP is in the brain as well. So it's a brain thing. There's no signaling to your brain that you have taken in enough food. And then leptin, the satiety hormone, is down. It's not working. It's not able to work because there's a lack of GLP. So that's just telling you you're not satisfied. You're not satisfied. You're not satisfied. You might as well just keep eating because you're not satisfied. You're not full. And then you're just in this metabolic, chaotic state where food is driving fat and fat is inflammatory. And then inflammation is driving brain fog and cardiovascular disease and cancer. And nothing is working. It's this big vicious cycle. So you see why this could be the answer. It really could be the answer. And that's not even talking about the liver. What about fatty liver? That's huge. We're seeing fatty liver everywhere, non-alcoholic fatty liver disease. And this is where fat is literally permeating the liver. Now, the biggest cause of fatty liver is high insulin and high glucose. Now, when we walk around with a fatty liver, it can lead to liver cancer, but it can also lead to just marbling of the muscle. Your muscle ends up becoming fatty. It starts affecting your heart. Your ability to detoxify goes down the toilet, and you become one big toxic, sludgy mess because your liver can't even function. Your muscles become dehydrated. You start to lose muscle. It's crazy what obesity, what excess fat can do to the body. And I think we are forgetting that in our society. We're starting to shift in a way that we are accepting of all body styles and types. And that's great to a point, but we're losing the message that there's also an unhealthy aspect of carrying around excess weight. This isn't about vanity or being a supermodel or being twiggy or fitting into Abercrombie and Fitch clothes that are 5 sizes too small. This is about your health. And the bottom line is, if you're confident carrying around excess weight, that is one thing. That is awesome. But it's not healthy for us to carry around excess weight. We know what excess body fat can do. So you might be feeling great and confident right now, but down the road, You are going to be hurting as you battle all these different diseases that are tied to obesity. Okay, now what about microdosing and then hitting a weight loss plateau? You just keep going. You need for these GLPs to stack upon themselves. And what do we mean by that? So a lot of people will hit a plateau, and this is where the issues come in. These individuals will increase their dose. And that's where we will start to see the massive amounts of side effects come on. Then you might not need to increase your dose. Maybe you go up slightly. So if you were doing a microdose of, let's say, tirzepatide. So the normal dose of tirzepatide is 5 milligrams. The mini dose, a smaller dose or a starting dose is 2.5. And then a microdose is 1.25 or even 0.5 to 1 milligram. So you can see the difference. And these are vast differences. Going from 2.5 to 5 milligrams is a huge difference. It could mean muscle loss and nausea and heartburn or not. So if you're microdosing at 1.25, maybe you go up to 2.5 for a week and then go back down to 1.25. There are different ways that we can microdose if you hit a complete plateau. Long-term goal, you have to think about this long-term. That long-term goal is that it's going to be working on your metabolism extensively over time. And we want that slow weight loss anyways. We want that slow fat loss anyways, because anything that is too rapid, you will gain back. Again, think of Biggest Loser. All of those people gained all the weight back, all of it back. So we really have to come back to it. All comes back to obesity and excess fat on our body. And what does that look like for us for long-term metabolic health, for long-term health? And if we can do something that lowers all-cause mortality, like lowering our insulin, lowering our glucose, getting that body fat off of us, lowering our inflammation, improving our liver, improving our cardiovascular protection, improving our brain protection, then why wouldn't we do it? And this is really where my stance on GLPs has shifted, and shifted in a good way. It's shifted to be more open-minded, and not only open-minded, I've come full circle to say, believe, and use GLPs with patients in a way that I truly believe they will be transformative if done correctly, if all the boxes are checked. Because you, as a patient using these, you absolutely must adhere to and promise that you will lift heavy and get in adequate amounts of protein. Those are your two agreements. Those are your jobs. You're going to eat protein like it is your job. And I don't care if you do lose a little bit of appetite. If you're doing this correctly, you shouldn't. But if you do, then you do protein shakes. You get it in one way or the other because it's a non-negotiable. Other non-negotiables, taking in minerals, because there is a little bit, especially again with the higher doses, all of these negatives come with the higher doses, or rather the starting doses that most doctors start people on. The complete loss of appetite is with the higher doses to where you can't even get your protein in. But even if you have a smidgen decrease of appetite, I would still want you to do protein shakes and literally eat protein like it is your job. And, I think right now in the medical community and even in the functional medical community, GLPs are kind of a money grab, a money maker, just like pellets. And listen, we all need to make money, but starting people at a higher dose, you're going to blow through that a lot faster than you would if you started at a microdose. So essentially, you can be on a monthly subscription to these GLPs, but you might be able to stretch that out 2 months. So yeah, absolutely. They are an investment. They are a couple $100s. They're not thousands like they are in prescription form. If you are not a full-blown type 2 diabetic and you go to the pharmacy to try to pick up Monjaro, $2,000 a month easily. So you're not looking at that, definitely a couple hundred, but you can take that 2.5 or 5 milligram dose and microdose it because you are in control of what you pull out of that vial. And just for those who don't know, GLPs are a once a week injection with a teeny tiny little insulin needle. It's easy breezy. You don't even feel it. This is what we use for all peptide injections, but it is a once a week injection. So you can control the amount that you pull out of the vial. So if your prescription is for 2.5 milligrams, and let's say you pull back to the 25th tick mark on your little insulin syringe, well, then half of that would equal half the dose. So to get to 1.25 of tirzepatide, you would pull back to the 12.5. And then the same math applies to semaglutide. Semaglutide, you say it one way, I say it the other. Don't know which way is the right way, but semaglutide, sema. Now, the differences between sema and tirzepatide. Tirza is a GLP-1 GIP agonist. And the reason why it gained such popularity when it first came out, even in the form of Monjaro, is that the side effects are much, much less. Now, sema is cheaper than Tirza, but it does come with more side effects. But again, this is only in the high doses or the starting doses. So essentially, if one doesn't work for you, it's kind of like a thyroid medication. If one doesn't work for you, let's try the other one because maybe that one will. And hey, it's a little bit cheaper. But both of them work very, very well for microdosing. You have to find your dose that works for you and just ride it out. This is not going to be Biggest Loser weight loss. This is going to be the long game. You're in it for the long game. Now, let's address the people that maybe you're not type 2 diabetic, but you're definitely insulin resistant. And I like insulin below 6, A1C between a 4.8 and a 5.2. I love when your glucose is under control. If you are not a full-blown type 2, there's no way you qualify for this, but you want to add it in. Okay, maybe for you that are seriously insulin resistant and really have, let's say, over 30 pounds to lose, we might start at a higher dose because it's more important that we get you out of that state. And, you probably have fatty liver as well. And by the time you hit insulin resistance, by the way, your system has been under stress for a while. Your metabolism has been a disaster for a while. Your mitochondrial health has been in the toilet for a while. Because by the time insulin resistance shows up, inflammation has been there for years, like 10, 20 years. And we see this go hand in hand with thyroid issues. I would say 95% of all hypothyroid patients are insulin resistant. So what do I always say about insulin resistance? We got to fix your thyroid first. And then how long have you been sitting around undiagnosed with a thyroid problem or walking around with Hashimoto's and not being told that you have Hashimoto's? That could be a while. So we need to get you out of that inflamed, metabolically broken state. And that to me is more important than the side effects that you might get from using this drug. Probably won't get if used properly in the lower doses. So a woman hits menopause. Here comes thyropause, because we know over the age of 40, you probably have a thyroid problem. You're just not being diagnosed. And now you have insulin resistance. And now that hormonal dysfunction is starting in your brain and you're getting cravings like you've never had before. And out of the blue, here comes 10 pounds. Oh my God. And then you're going to keep putting on weight. So over the next decade, now you'd be 30, 40, 50 pounds heavier. That puts you at a metabolic disadvantage and a higher risk for all-cause mortality. And what your doctor will do is give you Band-Aid medications and maybe even metformin, right? Hey, okay, here's some metformin. Good luck. But we need long-term help. You need to change what you're eating. You need to address your thyroid dysfunction, but maybe using a low-dose GLP, microdosing GLP will get you out of that crazy inflamed state to where everything will work then when you do it correctly. Inflammatory bowel disease, IBD. Okay, here's another one. Crohn's. Oh my gosh. Well, Crohn's is autoimmune, so that would make sense. We're reducing that autoimmune ball of fire. And we're actually helping with inflammatory bowel disease. So instead of poo-pooing the GLPs, oh my God, they cause gastroparesis and acid reflux. Yep, they certainly do in higher doses. Why don't we use them in lower doses to actually help your gut, to help ulcerative colitis, to help IBD? Oh my God. To help your depression, to help your brain, to help your high blood pressure, to improve your cardiovascular health, to improve early onset dementia or Alzheimer's. As soon as you see that coming on, those memory blips, the changes in personality, and you might see this in yourself, you might see this in your parents, then that would be a great time to add in or talk to mom and dad about adding in a GLP just to protect their brain. Had I known, well, they weren't really out back then. There's so much that I didn't know when my mom was suffering with dementia moving into Alzheimer's that, oh my gosh, if I knew then what I know now, just a few years later, I truly believe that I could have made a difference, because there is such thing as neuroplasticity. We can rewire new pathways, and these peptides actually help with neuroplasticity. Now, would I go so far as to say we can be using this in autism or ADD, ADHD? Maybe. I don't know what the long-term effect would be using it with an autistic child, but it would be very, very interesting if this does increase neuroplasticity. It would be interesting if we couldn't get some kind of movement in brain function and cognition by using these with autistic or developmentally delayed kiddos. So I think by now you can see the benefits of microdosing GLPs. And if you check the show notes, I do have a resource for you so you can get a hold of GLPs, start microdosing them, and not have to beg your doctor, who might freak out and not even know what microdosing of GLPs means or what the benefits are. But you can check the show notes for that. I just hope that this educates you and opens your mind to some other tools that you can use. Of course, again, in conjunction with optimizing your thyroid and optimizing your hormones and changing your lifestyle and changing your eating. You still have to do all those things. And you still got to lift heavy. You still got to eat protein. You have to eat protein. But I believe that this microdosing, I don't know what it would be called. It's not a phenomenon, because phenomenons come and go. A new microdosing theory can really take hold and start changing our society and changing the health of our nation, the metabolic health of our nation. Because as you know, if you're not living it, go to a Walmart, go to an amusement park, go to the mall, and just spend an hour counting the amount of healthy people you see. So I'm not talking skinny fat. I don't mean teenagers. I mean adults who look fit, who are not carrying over 20 pounds of excess weight, who look like they might pick up a weight and maybe take care of themselves. It's few and far between. And you're going to be able to count on one hand if you get any at all. So it's a pretty sick state that we're in physically. And we need something in this war against obesity to change it. Now, if you're taking things like T2, like T3, like testosterone, all the things that increase your metabolism, keep doing it. Again, this is just another tool. This is not going to produce rapid weight loss, because we don't want that, but it is going to improve your metabolic health long term. So just stay tuned. I have much more about microdosing coming up. My interviews with experts. I will do a follow-up solo episode on microdosing as I use it more, implement it more, use it on myself, use it with patients. And I will keep bringing you the information that you need to up-level your health.